it. So what
Hello, Mr. Steven.
I think he has been cut off. Sorry to interrupt or to barge in like this.
Yes, Ebenezer. Yeah, yes. So I was making a point that I have a technical challenge with joining the meeting on my laptop. So
Okay.
you would have to use the PowerPoint. You have to project the PowerPoint as I present.
Okay, no problem at all, no problem.
Yes, just that there were some things I had wanted to show up. Unfortunately, I may not be able, but I'm at the end of the presentation, I will share with them lecture videos and links to sites to get all those stuff. So it's not, I don't think it's a big deal then.
Yeah, okay, sure.
Yes, all right. So you all welcome to this research training, and today happens to be the second day we having this meeting. Today I'm presenting on research methods and designs. My name is Stephen Opoku. I wouldn't like to talk very much because Ebenezer has already given a lot. I mean, he's described everything I do. I personally also work with him, so I think he knows everything about me. So I will just go away to the point. Also, as we all know, so long as we are professionals, we know that in Zoom, if you are not presenting, you don't. You actually have to mute your point, your microphone, and make sure everything is intact, so that you don't disturb others as they intend to talk. So try as much as possible to mute yourselves as we present. Yes. So one most interesting aspect of research is the design. I mean, I always say it's the heart of research. So before we start, I know that last week you might have gotten some introduction to research. And today, as I start, you would really enjoy one aspect. What I'm going to do is I'm not just going to present, but rather I would like to take you through the practical way forward. When I say practical way forward, what actually you should do when you are actually conducting your research. So instead of presenting, I'll rather just be giving you personal examples as to how we apply, or whatever I say, I'll tell you how I apply them in writing my papers most of the times when I'm presenting. So that's how it's going to be. So without wasting much time, Eben, let's go to the first part of our slide, which talks about our roadmap. So by the end of this module, you should be able to identify and explain the types of designs in epidemiology. So you should be able to tell us all the study designs in epidemiology, at least the common ones, if not all of them, at least the most common ones. You should be able to tell us some of them and explain what they are. Second, I would also talk about sampling techniques. So you should be able to choose a suitable sampling technique for your research question. So there are several sampling techniques that can be used. But I mean, what I'm going to say is today, which one am I supposed to choose at what time? Then you should be able to apply these methods to your project and manuscript. Today, my projections would be more of manuscripts rather than just presentation. So I would also urge you to, how do you apply whatever we learned today to writing your manuscript as well as your thesis or your project or whatever research you are doing? So Ebenezer, let's keep the ball rolling. So study design. Basically, last week I was on the Zoom and I remember you guys were all taught what research was. So study design actually is the overall strategy utilized to carry out research that defines a senate and logical plan to establish the research question. The research question I always call the topic is first thing in research. And like we always say, in research, when you search the research question, the next thing is, how am I going to execute it? I'm giving a baseline example, like when you want to build a building, you may decide I would want to build a sports stadium. That is your research question. Let's say a sports stadium that can contain, let's say, 100,000 people. That is your research question. The study design here is the overall strategy that you would need to go through to get to building that stadium. It's your study design. So basically, it entails a lot. It has sub portions. Like we say, we're building a stadium. We will need carpenters. We will need contractors. We will need architects. We will need a lot of sort of people that would come together. So it has kind of branches of the design of a research kind of have subsections that needs to be looked at. And I think that is the most important and the basic reason why we are here. So even let's go to the basic study designs. So the common study, so we are going to look at study designs in epidemiology. So basically, especially in Africa, we mostly do epidemiological studies. And especially majority of us who are in health, we mostly do epidemiological studies. So I would want to tell you study designs in epidemiology, and I would urge you to also put a lot of things down because my notes are going to be set. Though he will send you the recording, but I would urge you to get a sheet of paper. When I say some things and you think they are very important or substantial, you can write them down and later you can attend to them. I think they are very, the information is very key here. So basically, study designs in epidemiology can be observational or experimental. So I'll start from experimental. Experimental, sometimes called interventional studies, involves intervention. When I say intervention, sometimes it always involves giving people something. So mostly they are given a drug, they are given counseling, or they are given, yes, hello. Yeah, so they are given something before and at the end of the study. So yes, can you all try mute yourselves? Yes, hello. Yes, Ebenezer. Okay, so I think he's tried to mute some of them. So experimental study, like I'm explaining, it always involves intervention. Mostly what I always experience is our patients are given some drugs or probably people take vaccine, we evaluate them. That are experimental studies. So example are the randomized control trials, community trials, and field trials. All these are experimental studies. Then we come to observational studies, which are mostly conducted in Africa, especially at our level as students, we'll be doing observational studies. Observational studies can be descriptive or analytical. So descriptive as in, when you see the case, you just present it, and mostly it involves individual level. When I say individual level, sometimes only one person, just one person. So examples are of descriptive studies basically we encounter are the case reports and case series. So let me give you one example of case reports. Case reports are mostly uncommon situations that happen in clinical settings or anywhere. Example, I wouldn't give I have very tangible example in microbiology where extended spectrum beta lactamase was Staphylococcus aureus was isolated from a child who is just like 1 week. And you know, before you can ESBL can be isolated from you, you might have taken some spectrum of antibiotics. But this child who is naive to antibiotics, we were able to isolate ESBL from that child. And this is so abnormal, you understand? It's so abnormal. Let me give you one funny example. Let's assume you are in the hospital, you do pregnancy test for a man, and it turns to be positive. You validated everything, you repeated the test multiple times, you did it again, and the man was still positive. You did confirmatory tests, like serum pregnancy tests, and the man was still positive. You did all tumor markers, and you realized that the person did not have cancer, but specifically that man is pregnant. This is so abnormal. So it's a case report. So case reports are mostly involving one or two people who present abnormal cases. case series as part of descriptive studies. Let me give you the scenario of HIV, how HIV was discovered. People realized that one man came to the hospital, he was immunocompromised, was detained, and soon he died. Another person also came with the same thing. The same, like people were coming with the same trend. And then they got to realize that the person who died today had sex with that person who came here last week, realized that person also had personal contact or sex with the other person who died. So kind of series of cases, one person leading to the other, leading to the next. And that is what we call case series. And that is how HIV as an immunodeficiency disease was discovered. Yes. So descriptive studies. These are basically case series, case reports. Let's go to analytics. So descriptive studies too, there is one most important thing you must put in your mind. Like I said, you can put down a lot of points. I have presentation on them, but I will not talk much about them. So descriptive studies, you are allowed to describe PPT. I mean PPT. And then the P is the population. Another P is a place. And then the T is the time. So the population, the place, and then the time. You are not going to make associations. You are not going to make differences. You are just going to present the situation as it happened. So let's say in the year 2010, ESBL Staphylococcus aureus was isolated from a child who is 5 years old in, let's say, a teaching hospital in Ghana. So you have the place, which is a teaching hospital in Ghana. The population was the child. And then the time was the 2010 you spoke about. So it's very crucial when you're talking about descriptive studies. We could also talk about, and in this case, you are not allowed to tell us why this situation is happening. Just tell us that this happened at what time at this place. So that is how descriptive studies occur. Unfortunately, like I said, I have a technical challenge. I had one paper I had wanted to show to you, but I will send you links to all those papers for you to know how they report descriptive studies. Now let's go to analytical studies. Analytical studies include the cross-sectional studies, case control, and cohort study. So I will talk about them in the next slide, but note, sometimes some analytical studies like cross-sectional study can be descriptive. So note, although cross-sectional study is purely analytical, it can be descriptive depending on how it was conducted. Example, Dr. Redu et al. Looked at complication of type 2 diabetes in Ghana, a cross-sectional study. He just looked at the common complications were retinopathy, nephropathy, and let's say erectile dysfunction. That's all he reported. He didn't look at factors associated with that complications. So in this case, he didn't look at why. You understand? So he didn't really look at why a situation is happening. So in this case, it's just purely descriptive. So I repeat again, a cross-sectional study, although analytical, because mostly we look at, after looking at the descriptive nature of the cross-sectional study, we look at the factors or anything that are associated, why something is happening that way. And therefore, a cross-sectional study can be descriptive or analytical depending on how it is conducted. Yes. There are other study designs which are currently more or other observational studies which I will talk about, like retrospective, prospective, longitudinal study. I'll talk about them as we move. Eben, let's move forward. So like I've already said earlier, there are two main types of study designs: experimental and observational studies. So in experimental study, it involves intervening some way to affect the outcome. Example is clinical trials, animal study. So what we do is in experimental studies, example is we did one interventional study last 2 years. We looked at impact of iron fortification on malaria and anemia among preschool children in Ghana. So we were looking at if children who are below 5 years, if they take iron, food that contain iron supplement, is it going to reduce their risk of getting malaria and anemia? So, that is a totally experimental study. Someone is also looking at the impact of palm oils on A beta lipoproteinemia. He's taking mice, giving them palm oil as part of their diet, and against those who are not taking palm oil, to see what happens to their lipids. Ours, the outcome was anemia, malaria and anemia. So we're looking at how iron, the intervention here is iron supplement, and then the outcome of interest in our study was anemia and malaria. The one looking at the impact of palm oil supplementation on A beta lipoproteinemia, the intervention is the palm oil supplementation, and then the outcome is the lipoproteins, which is the A beta lipoproteinemia. So these are the experimental studies I spoke about. Observational studies are those in which the investigator does nothing to affect the outcome, but simply observe what happens. So simple. Example, like we want to compare the level of, I can say, hemoglobin between patients with diabetes and those without diabetes. Interestingly, we just don't give them anything. We just observe that if you have diabetes, what happens to you? If you do not have diabetes, what again happens to you? So in doing so, that is just observational study. We are just observing. We don't give them anything. We don't give them any drug. We don't give them any counseling. Remember, experimental studies do not always involve the giving the patient or the participant a drug. Sometimes counseling is even an intervention. Someone was looking at the impact of counseling on diet counseling on fasting blood glucose among diabetic patients. So they were looking at diabetes patients who receive counseling on the type of food to eat against the placebo, those who are not given anything, and see how it affects their glucose management. So these are the experimental studies. So observational studies, let's take them, the cross-sectional study one by. So we are going to talk mostly about the observational studies, like I said, in Africa, and we as students, we are going to start with observational studies. As we grow and get grants, we are going to do experimental studies. So those studies are mostly, okay, we would allow you to ask questions as we move along. So try write your questions down as we move along in the presentation. So when I end, I will urge you, or I would open the floor for you to ask questions. So cross-sectional study. These studies are those that are carried at a single point in time. And mostly cross-sectional studies, you just come to the population, just take variables of interest. So we wanted to see factors associated with viral suppression among HIV patients. So we wanted to see why is it that HIV patients are all taking drugs. Some are virally suppressed, others are not, their viral load is not going down. So we wanted to look at what are the factors. We just came there once, took their viral loads, asked them questions. And then at the end of the day, we were able to associate the factors associated with viral suppression. Another example is prevalence and factors associated with gestational diabetes among pregnant women. So we wanted to see why some pregnant women have gestational diabetes, others do not have. So it was a cross-sectional study because we came at once and then we asked the pregnant women questions, took their fasting blood glucose to assess gestational diabetes. And at the end of the day, we were able to explore the factors associated with gestational diabetes. Here, we should know that because we are just asking questions, or we were not able to witness what really is the cause, because we are just asking you questions sometimes, or we measure something, which we didn't really give you a drug. We cannot make cause-effect relationship. When I say cause-effect relationship, like I was saying in experimental studies, we were seeing impact of iron supplements on malaria and anemia. So we gave one group iron, other group took nothing. We looked at malaria and anemia in both groups. At the end of the day, if malaria is very low in those who took iron, we can say that, oh, people not taking iron supplements have reduced rates of malaria or anemia. So in this case, we can look at the cause and then the effect. But when you want to look at the factors associated with gestational diabetes, in this case, we just came, ask them questions, measure their fasting blood glucose at multiple times to assess gestational diabetes. Even if educational level is associated with gestational diabetes, you can't say it is the cause because it was not interventional. You didn't really control it. Yes. So that is the cross-sectional. So it estimates the incidence of a disease or the trend over time. So mostly we can look at how the disease is behaving over time. So we could look at prevalence of COVID-19 in Ghana. We could look at it in 2016, 2020, 2021. So these ones, we could also look at repeated cross-sectional studies that are carried over time point to assess trend over time. So people did prevalence of gestational diabetes in Kumasi in 2010. People did it in 2015. We did it in 2022. So these are repeated cross-sectionals to look at how things are varying with time. Longitudinal studies. So longitudinal studies are also, like I said, although in my figure you wouldn't see it, but it's a type of observational study whereby most of the times you look at it as we move forward. So we say it is prospective. So moving forward, it is prospective because we are looking at how something occurs as time goes on. An example is preeclampsia. So let's take this example. Preeclampsia is hypertension that occurs in pregnancy. So one lecturer actually looked at the factors associated with preeclampsia. There are two ways of doing that. You just wait for them to get preeclampsia, come and ask them questions. Were you smoking? Were you taking alcohol? Then you can look at the factors. In this case, it's a point prevalence because it just came there at once. But another way of doing that is we recruit, let's say, 1,000 pregnant women, let them go to the delivery. At a point, we can follow them forward. Let's say we recruit them at the first month of pregnancy, follow them to 9 months. Some will develop preeclampsia, some will not develop. And since we are following them over time, we say it is what? A longitudinal study. Yes, let's move on. Retrospective study. Actually, we could also go to the hospital, like the same example I did for prospective. In retrospective study, we could go to the hospital, look at patient folders, let's say 1,000 patients who gave birth, and just see those who had preeclampsia, those who didn't have preeclampsia. Now, we don't see the patient. It's not like the longitudinal whereby you follow them, you see them. Now, you only go there and take their records, and that makes it retrospective. That is going back to what already exists to find reasons to why something happened that way. So basically, I've talked about cross-sectional studies, longitudinal studies. Now let's go to case control study. So case control study is a study design that actually looks at one group who are the cases and then one group who are the controls. The cases have the disease and then the controls do not have the disease. We see what happens to both of them. So let's say I want to see the level of hemoglobin in diabetics as cases and non-diabetics as controls. What I do is I pick cases who are, my cases here are going to be diabetes patients, and then controls, non-diabetes patients, to compare the levels of HB in the non-disease, which is the controls, compared to the diabetes patient. In doing so, I'm doing a case control study. In a case control study, whatever I find, I am going to ask them questions. Let's say the cases are the diabetes patient, the controls are the non-diabetes. I'll definitely ask them questions. Do you smoke? Because maybe I wanted to also look at why people are having diabetes, others are not having diabetes. I see their lifestyle, their levels of some markers, And in doing so, I'll be able to, per the trend of questions and things I measure from them, I may be able to establish association or factors that are associated with diabetes. Remember, case control study is retrospective in nature. So note, case control study is retrospective in nature. Why? Because you can't meet the patient today, but in this case, you ask them questions. Are you smoking? Are you taking alcohol? Are you doing this? You know, they have the patient, although you meet them at present, but they are going to answer questions based on their past. So that makes it a retrospective study. One thing I would want to spend like 2 minutes to talk about in general, what I've said so far. So I said study designs are into two parts: observational studies and experimental. Experimental studies always involve intervention. That is either giving patient a drug or counseling. Observational studies, you don't give patient anything, you don't intervene them with anything. You rather wait and observe what happens. Experimental studies can include clinical trials, randomized control trials, and then the field trials. We even have community trials. I wouldn't want to go there deeply, like I said, because mostly you need grants to do clinical trials or experimental studies. They are expensive, they require ethics, thorough ethics. You have to get ethical approval from institutions. Even publishing clinical trials require clinical trial registry, which is not easy at our level. Although I'll mention as we move forward, but I expect that we focus much on observational studies, which we would be doing most of the time. So observational studies, I said, can be descriptive, and purely descriptive observational studies are the case reports and case series. Like I said, case report is mostly abnormal case, which is mostly seen at the hospital. Case series is when we have one case leading to the other, and we realize that the first case was related to the second. The second was also maybe related to the third. We came to analytical studies, which is part of observational studies, and we say it can be cross-sectional, observing them at one time. It can be case control, as in looking at cases and controls. It can be cohort, which I didn't speak about. Cohort studies are actually taking a group of people, then following them over time. So it's like prospective. It's a prospective study, but it's kind of a special study looking at, let's say, predictors of preeclampsia. You recruit, let's say, 1,000 pregnant women, follow them till they get preeclampsia. See why some of them got and why some of them didn't get. Like unlike case control studies, you just pick the pregnant women who already have preeclampsia against those who do not have preeclampsia. Then ask them questions retrospectively to see why some have preeclampsia and others do not have. Case control studies in statistics, we look at the odd ratio, which means the chances of getting the condition, let's say diabetes or preeclampsia, against the chances of not getting the condition. In cohort studies, we look at relative risks, which is the risk of getting the disease against the risk of not getting the disease. They are deeply statistics, which I wouldn't want to go deep down. Yeah, so Ebenezer, let's go to the next slide. So this ends our presentation of sampling techniques. I will take 5 minutes questions and we'll go to sampling. This ends our study designs. So I'll take questions and we go to sampling techniques. The last part of my presentation, I'm going to show you how some study designs were put down in published papers, and we will all go through together. Yeah, so questions before we move to the next.
Okay, my hand is raised up, but can I go ahead?
Yes, you can go ahead.
Okay. Thank you so much. I think I can answer somehow, but I just need to be clarified. A situation where you're taking research study on factors affluent.
It seems people are talking at the background. So can we have our mics muted, because I can't hear whatever she's saying. Yeah, so please go on. Yes.
Okay, so I just wanted to find out a research study where we are trying to find find parents not accepting immunization.
I can't really hear anything.
Hello, Sarah. Please, can you check your background noise so that you could talk well to our hearing? If you are close to any radio
or you can basically type your question. I think you can.
Yeah.
If you think your background is not helping, you can type it and I'll help you.
I think I have a question. Can I go ahead?
Yes. The background noise from one person is too high. Can we have that person muted?
Actually, the noise is coming from someone called Fortune F. Young. If you could mute that person, I think that's where the noise is actually coming from.
Ebenezer, okay. Yeah, so the question, yes, I'm waiting.
Yeah, thank you so much for the lecture. I've been enjoying it so far. Well, I just have this question. You briefly mentioned something related to population when you were delivering the lecture. I just want to know, how does population determine which of the research design we are going to use, either observation or experimental? You mentioned something briefly in that part when you were talking.
Okay, thank you very much. So, Eben, can you put on the flow diagram for me? The PowerPoint that has the flow chart. Good. So case series and case reports, mostly the population here, people involved here, are usually one person. So mostly one or two people, mostly it doesn't involve large population. So like I said earlier, case report, for instance, is only one person who come with abnormal case. But case series may involve, let's say, up to 20 people. So that one is just an abnormal case that is being presented. Are you getting me? But cross-sectional and case control, cohort studies, clinical trials, that depends on your research question. So they are open. I mean, they are not limited as to who can I conduct it with. It depends on the kind of research question or your research topic you are dealing with. Example, we look at, it was a clinical trial, we looked at impact of iron fortification on malaria and anemia among preschool children. So here we consider children under 5 years old. So in this case, the whole population involves anyone who is under 5 years. But like a case report, you can't just determine the population. You can't even plan for it. It comes as unfortunate. You are just at the hospital, you get a man who is pregnant. So there is nothing like population. It's just an unforeseen situation. So it's like COVID, how COVID came in. It was like the case report of COVID was when that man came to Wuhan and he was having abnormal cough, sore throat, and the symptoms of COVID. They didn't know. So they were treating him, he was not responding. They tried all means, he was not responding. So they said abnormal respiratory syndrome infection has come and patients do not really respond to antipyretics or any treatment. In Africa, they'll say they do not, if the COVID patient initially presented like malaria, you give them malaria, anything, they are not responding. So that is kind of a case report. And this one, anybody at all can get it, whether a child, a male, pregnant woman, whoever it's involved can get it. So you cannot set a population for case series, case report. And the case report of COVID was when they realized that in Ghana, the first person who brought it was identified. The second person who also came was known to be related or might have met the first person. The third person might have gone to a party to meet the second person. So that is the case series. But for the cross-sectional, case control, cohort, and clinical trials, we have our population of interest, and we set it based on our research question or topic. I don't know if I've really answered your question. Are you okay now?
Hear me? Can you hear me?
Yes, I can hear you very well.
Yeah, basically can understand the.
Yes, so you understand now, right? Yes, I hope you understand now. Hello. All right, Ebenezer, I think we can move on to the next question.
Yes, so on the chat bottom from Sarah, yeah, she said, my question is, a situation where we are trying to ascertain the factors encouraging a particular behavior, let's say poor uptake of immunization, which study design will be appropriate? I'm guessing an observational study, particularly cross-sectional study. Am I right? So that's from Sarah.
Okay, so thank you, Sarah. So when you want to look at example, is mostly we were looking at factors. Okay, you are looking at factors associated with low uptake of immunization. And mostly this year, people conducted a lot about factors associated with vaccine, COVID-19 vaccine uptake among Nigerians or among Ghanaians. This one, we are just going there one time. Will you take the vaccine, yes or no? Then we ask you questions. What are the factors? Educational level, gender, and other questions. And therefore, this is a purely cross-sectional study design that could be used to assess that. And we have a study, one study, which unfortunately, I could not use my laptop. I would have shown you a similar study we have conducted in Ghana here, which we look at factors associated with COVID-19 vaccine acceptability among people in the rural areas of Ghana. Yes, so it's a cross-sectional study. So automatically a cross-sectional study that best fits it. Okay, can you explain?
Okay.
Okay.
Okay, thank you. So the next question is from Ijai Drisu. He's saying that my question is, there any time limit in cohort study?
Okay, okay, good. So thank you. So cohort studies, for instance, is mostly you recruit them, follow them over time. An example is like pregnancy. We wanted to see factors associated with preeclampsia among pregnant women. So you are recruited in the study, and then you follow them till the time ends. But it depends on the size of that cohort study. We have small cohort studies like predictors of preeclampsia. We recruit pregnant women, follow them till they actually deliver, and that is all. So in this case, there is no time frame. The time is just when you deliver, you are out. You are done with the study. I hope you are okay. So in that case, there is time bound. But there is a nursing study or the contraceptive study, cohort study. They recruited about 100,000 pregnant women looking at how contraceptive use may affect their life, reproductive life, and other part of lives. And in this case, you realize that there are a lot of things they can look at. Sometimes they look at it over 100 years. People die in the process. And human behavior can be studied in generations. So you can study people, look at what even happens to their next generation. So in this case, cohort studies sometimes are time bound, and mostly people die out of the cohort. People lost to follow up. When you say lost to follow up, they join the cohort studies, but with time, they realize that they are no more interested, or because of something they've developed, you don't even find them again. So if it is a large cohort study, you realize that it is not time bound. You are either lost to follow up or you die out of the study. So thank you. But in the small cohort studies, you can easily end the study, especially pregnant women. When you give birth, you are done.
Okay, thank you. So the next question is from Rukayat. So she's saying that, can you please expatiate on the difference between a case control study and a cohort study?
Okay, thank you. So case control study, the people have already developed the disease. Then you intentionally look for people who have not developed the disease, compare their lifestyle, the things they do. So let's say lung cancer, when we want to look at factors associated with lung cancer, and I'm doing a case control study, in this case, I'm going to take, let's say, 100 patients who have lung cancer against 100 non-lung cancer patients. See whether they smoke, see whether they take alcohol, and other things I can measure. So in this case, I realize that they have already developed the disease before recruitment. And I ask them questions so that they can answer. But in cohort study, you recruit, let's say, a large number of people, let's say 100,000 men. Then you leave them. Definitely some of them will smoke, some of them will take alcohol, some of them will be doing different things in life. You record them. Follow them till some of them develop lung cancer, others do not develop lung cancer. Then you can compare. Why is it that some develop lung cancer? Why is it that others did not develop? You realize that the cohort studies, because you are following them forward prospectively over time, you are able to expectantly identify why something is happening. So you are able to see that, oh, okay, as time goes on, these people were smoking, and therefore they developed lung cancer, others were not. But in case control study, you recruit lung cancer against non-lung cancer. Then you ask them questions whether they were smoking or not. So case control basically is a retrospective, like I said earlier. And at the time of recruitment, the cases have the disease, the controls do not have the disease. But in cohort studies, especially the prospective cohort, you recruit them as baseline, nobody has the disease. You follow them over time to see when they have the disease and others do not have. You now look at what was happening as time was going to associate them with the disease. Thank you.
Okay, so thank you. With the next one also from Rukayat. So she's saying that, suppose I want to conduct a study on a particular behavior starting from childhood stage to adult stage. Can we say cohort study is best used here?
Okay, so can I, if he would want to elaborate on, suppose I want to conduct on a particular behavior, I mean, in the research, you just cannot elaborate on a behavior. We must have an outcome of interest. Let's say, is behavior at childhood going to affect the student performance at adulthood? Then you can recruit 10,000 students and follow them, look at their behavior and how it will affect their academic performance when they become adults, or how it even influences their responsibility when they become adults or parents. So that one is a good cohort study. A cohort study can do that simple.
Okay, thank you. So another question from Kingsley. He's saying that, what kind of study design can be used when you access a particular biomarkers among maybe blood donors and also use non-blood donors as controls?
Okay, so good. So this is mistakes people do. So in this case, we are comparing, let's say, if people donate blood, it's expected that their hemoglobin level is going to reduce. Or I mean, it makes sense because, or their erythropoietin may be overworking because it is working to replace the lost blood. So we may want to measure a biomarker, say erythropoietin activity among blood donors compared to non-blood donors. It is never a case control study because in a case control, the cases have the disease while you recruit them, and then the controls do not have a disease. Note, donating the blood is not a disease. So in this case, we call it a comparative cross-sectional. So they are all human beings in our community. The only difference between them is one donated blood, others did not donate. So we interview all of them, measure the biomarker, and compare among blood donors and then non-blood donors. And that is what we call comparative cross-sectional. It's a cross-sectional study, but you are comparing the biomarker between blood donors and non-blood donors. So note, donating blood is not a disease, so you cannot do a case control study here. Thank you.
Yeah, thank you very much. So another question here, I hope this is the last one. She's asking from Aisha, can you re-explain cross-sectional studies, please?
Okay, so in a cross-sectional study, like I said earlier, we wanted to look at, let's say, factors associated with COVID-19 vaccine acceptability. Why is it that some would accept COVID-19 vaccine, others will not accept? Then we want to look at factors, say, educational level, income level, region of geographical region, whether the person is in a rural area or urban area, or probably a village or a city. We want to look at their lifestyle factors and other things. So you realize that we just come at a single point in time, recruit, let's say, 2,000 patients, ask them these questions about whether they will accept the vaccine or not. We ask them the factors, possible factors. Let's say, do you smoke or not? What is your educational level? What is your age? Then when we do that, we are simultaneously measuring the exposures, which are the factors, and then the outcome, which is the COVID-19 vaccine acceptability. So cross-sectional study, we come to a population at once, and then the population must have similar characteristics. It's not like a case control, which I just explained, saying that one have the disease, others do not have it. No. Here they are all the same people, probably, let's say, pregnant women or footballers or teenagers. They have the same characteristics. I come to them one time, ask them questions about an outcome, let's say COVID-19 vaccine acceptability. And then I look at why some will accept, some will not accept, which is the factors as well. So I just ask them at one time and I'm good to go.
Okay, so thank you. So I think that is it for the first session. I think we can proceed with the next aspect. I think there's the next. I don't know if you will want to address it or we should proceed. Steve. Okay, so I think Steven's network is a bit down. We have to. Okay, Steven, please, can you hear me now? Ken Ahmed, please, are you giving a contribution or a question? Stevie, can you hear me now? Okay, so we have to wait a few seconds. I think Mr. Stevie is readjusting himself. Okay,
Oh,
he's here now.
not, I was muted. Sorry, I was muted.
Oh, okay. Okay. So sorry,
Yeah, so
sorry.
Ken Ahmed, I was making up a point to Ken Ahmed's question that if I'm clear with him, he's trying to say that if the study design, let's say case control study, cohort, and longitudinal studies, if they are actually, if there is an intervention, then they qualify to be under experimental study. And I was trying to elaborate that that is an error people do. Example, in our study, the experimental study, whereby we gave them children, some group took iron, others did not take iron. And then we're looking at how iron supplementation influenced malaria and anemia. Although one group took iron, the other group did not take iron. We followed them over time. So clinical trials or the experimental studies, definitely they will always be prospective. They are always going to be longitudinal. I don't know if you are getting me, but you cannot speak directly. They are not, there were some prospective or longitudinal techniques in there. There were case control techniques, as in people developed something, others were not. But you cannot call them case control, longitudinal, or any form. That is one mistake. I know people always do it. But note, longitudinal techniques can be applied in clinical trials. Because, I mean, if you give people a drug, you need to follow them over time to see what happens. You understand? But in doing so, you have to make sure that, I mean, you don't overlap. So case control studies, or especially longitudinal studies and prospective studies, are always going to be done in clinical trials. But a clinical trial can never be said to be a case control study. It's an overlap. When you do that, we call it study design overlap. Yes. So that's a bit explanation I have to your question.
Okay, so thank you so much. So I think we can proceed with the next session. Ask time is halfway, so we can proceed.
All right, so we are going to talk about sampling techniques. After looking at your study design, the next thing is you are going to sample the participant. I mean, let's say you look at prevalence of diabetes among adults. If I'm able to say that, I mean, the next question is, who am I going to sample? And then how am I even going to sample it? That brings us to sampling techniques. So Eben, let's go to the next slide. So we are going to look at population and sample. So population is the larger group we are really interested. So samples are drawn to support descriptive studies, often called surveys or analytical studies. I mean, I've spoken about this. So basically, samples are drawn to evaluate observational studies. So we've spoken about a descriptive study, analytical study. So Eben, let's go to the next slide. I have an image to show sample and a population. Good. So the population is the individuals selected, or the entire individuals which you think you might be interested to select some. So the whole population is a group of people who kind of they are in your mind, and you believe that you may select some of them to include in your study. So let me use this. We may want to, the bigger box here is all graduates. So that is the population. Then you see there is another subsection of the all graduate. We have graduate from health and related sciences. Then we could even say graduate from health and related sciences. We could say females. So in this case, all graduate from health and related sciences who are females. So we realize that the population can be divided into several sections. So population, we could have the study population, the target population, and then the overall population. So Eben, let's go back before we come back here. Good. So the external population is the population which we might be possible to extrapolate results from. So the external population can be Ghanaians. I mean, when you say Ghanaian, let's say prevalence of diabetes among Ghanaians. So when I say this, what I'm trying to say is that so the external population here is actually looking at all people who have the likelihood of being selected. So the external population, most people are not likely going to be selected. So when I say prevalence of diabetes among patients or among adults in Kumasi, you know, anybody in Kumasi is a Ghanaian. So the external population is going to be Ghanaians or adult Ghanaians. The target population is the immediate population to which results would be extrapolated. Individuals in this study would be derived from the target population. So that the population would be, let's say, all Ghanaians. Then the target population is going to be adult Ghanaians. So now children and I mean the age children are out and adolescents are out. So that we come to the target population. Go next. Then the study population is the population of individuals selected to participate. So study population could say adult Ghanaians living in the Kumasi metropolis. So look at here, the external population is all Ghanaians. The target population is adult Ghanaians, and then the study population, adult Ghanaians, let's say attending KNUST Hospital or attending University of Ibadan Hospital. So you see how it works. So you have to draw your external population, your target population, and then your study population. And then in your study population, you take some of them as your samples. So Eben, let's move to the next slide. So basically, I've been able to talk about external population, which is the broader version of the population. The target population, which there is likelihood that you select people from there. And then the study population, which you are exactly going to sample. Let's go to census and sample. Census, everybody or every individual in the population is sampled or evaluated. We looked at lecturer assessment, perception of histopathology or perception about histopathology lectures among medical laboratory students in Nigeria. What we are trying to do is anybody in the class or anybody in medical laboratory is going to answer. So here there is no exclusion criteria. So long as the person is in med lab, he's going to answer. So here is census. But sample data are collected from subset of the population. So that is what you should put it in your mind. So the sample, you are going to take a subset of the population. And you know, like I said, you have to first describe your external population, your target population, your study population, and then the sample itself. Next slide. So basically, we've been able to talk about the sample and the population. So the population is the overall individuals of interest. Then we have the external population, which is the same as the population. I mean, overall individuals, which you might likely select some of them. The target population, a portion of the population you are targeting to sample. And people in the target population have a possibility of joining the study. Then we come to the study population, the immediate population you are sampling from. Then we sample we take the samples from the study population. So sampling techniques. So there are two types of sampling techniques, or two broad types. We have the probability sampling technique and the non-probability sampling technique. So when we say probability sampling techniques, every individual in the population or the study population or the target population have a chance of joining the study. There is no bias. But in non-probability sampling techniques, some individuals do not have chance of joining. An example, it could be as your gender, it could be as your activity. If you are not a gay, you may not be allowed to join a study. Let's say if you don't attend hospital at a particular place, you may not be allowed to join. So that is a non-probability sampling technique. So non-probability sampling techniques are samples that are drawn without an explicit method for determining individual probability of selection. So we don't determine whether individuals are going to be included or not. Depending on what the researcher thinks, he selects and then he moves on. So example of non-probability sampling is judgmental sampling. And then this is type of sample chosen because the judgment of the investigator is a representative of the whole population. Example, in judgmental study, the person thinks that some group of people are best to answer his question. Let me ask this question. If I'm supposed to look at factors associated with HIV in a community, who are the people you are going to interview? You are supposed to interview people who involve or people who stand the risks of developing HIV. And therefore, I'm going to target sex workers or basically, male and female sex workers. So that is judgmental. Based on the question, the researcher believes that this group of people are best answering the question, are going to answer the questions. So that is just based on the person's perspective. Convenience sampling is just based on the convenience of the person or the researcher. So someone wants to conduct prevalence of malaria among children, but the person works in the X-ray unit in the hospital. So in this case, or the person works in the laboratory. So, or the person works in the optometry unit. So in this case, anybody who comes for eye care, if the person works in the optometry unit, anybody, he thinks he's convenient working in the eye care, he cannot go to the OPD, the outpatient department, or the surgical room, or the consulting room to take samples. He rather sits at his own convenience or comfort, let's say in the laboratory, in the psychiatric unit, and then just sample the people. And that is just the convenience. Purposive sampling is also a non-probability sampling technique that is selected based on the objective of the study. So you are selected based on the objective. Example, factors associated with gestational diabetes. Who are likely going to get gestational diabetes? It means pregnant women, because gestational diabetes is a type of diabetes which occur during pregnancy. So if you are not pregnant, you would never qualify to answer those questions. So based on the objective of the study, if you are not pregnant, you can't answer. Let's say factors associated with anemia among preschool children or among children living in urban communities. If you are not a preschool child and not living in a village, you are not going to answer, because the objective of the study or the main research focuses on children who are living in villages. If a random sampling is drawn from sampling unit meeting study criteria, then it becomes a probability sampling technique. Don't worry, I'll explain this further, but just note of convenience sampling. Basically, people use convenience sampling, but I don't like it because, I mean, you are just giving bias. The person may be good to answer your research question, but let's say if you are conveniently sitting in the lab or in the optometry unit, and then the patients who are supposed to answer your research question do not come there, you end up producing results with less power. Last one is referral or snowball sampling. Let me give you one example. If I come to Nigeria and I would want to conduct a study, say prevalence of HIV among lesbians, how are you going to get the lesbians? I think strategically, you get one lesbian, sample the person, immediately the person is done, he would refer you to the other colleague who is also a lesbian. When you are done with the second person, they'll connect till you get all the people of interest. So referral or snowball, you sample based on referral of subject of interest. So one person will direct you to the next. So if you see the image, one person is directing you to the next person to the next person to the next. That is how we talk about snowball or referral. Next slide. Then probability sampling technique. So here, any individual in the population, so earlier, like we say, snowball or the referral or convenience, the person may be having malaria, but if the person do not visit the optometry unit because the researcher is convenient there, the person is going to be lost. So, you know, there is bias. Any individual is not going to have the chance of answering the question. And that is not going to be a true representation of what exists in the population. So an imperative way of dealing this is use probability sampling technique. And the first one, probability sampling techniques, is a kind of sampling technique in which every individual in the population or the target population has a chance of being selected. Nobody is going to be excluded. We don't have to say you have to be a lesbian, we direct you to a next lesbian. No. Anybody in the population randomly is going to be selected. They have. So we have the simple random sampling. Let's say we have a class of 100 and I want 30 people. How do I sample 100? 30 out of the 100. I just label card 1 up to 100. Then I write on it yes or no. 30 yes, and then the remaining 70 no. Students are allowed to randomly pick a card at a time. All those who pick yes, irrespective of their number, are going to be included. All those who pick no are going to be excluded. And that is what we call the card or the card picking method. We could, or sometimes we use what we call computerized generated cards. We can give the children number 1 up to 100. Then we put the number 1 up to 100 inside the computer. Tell the computer to randomly select 30 numbers from 1 up to 100. It will select, already we give the students in the class numbers from 1 up to 100. If I select number 1, 48, 10, 15, 27, 30, then we come back to the class. Who is number 1? You have been selected. Number 15, you have been selected. Number 8, you have been selected. All those that were rejected by the computer are not going to be assigned. So we have the computer-generated cards, and then sometimes we even toss a coin. We call you, we toss a coin. If you get yes, you are included. If you get no's, you are included. So that is simple random sampling. Yes. So here, simple random, we have the whole population and we need just a small portion. So they just sample randomly. Continue on. To the next slide, systematic random sampling. I will explain using the next slide. So in systematic random sampling, I think, good, I'm going to use this. Let's say we have 10,000 students in a class. You only need 1,000. Oh, okay, we have 1,000 students and you need 100. So, I mean, if I just do simple random sampling that the class come and pick a card, there is a probability that all the first 100 are going to pick yes. And therefore, the remaining 900 will get the no's. It can happen. Who knows? That is probability. So simple random sampling, the disadvantage is that, like we said, we have 100 students, we wanted 30. We label card 30 yes, 70 no. But the disadvantage is that the first 30 can pick yes. In this case, the remaining are not given a chance. There is a bias because when they came, the yes had finished. So to avoid that, we develop a formula called the systematic sampling formula, whereby we look at the sample size. Let's say we have 100, we need 30. Or let's say 100, we need 20. So 100 divided by 20 is going to give us 5. So not everyone is going to pick. Every fifth person is going to pick. So you see this line. We had 1, 2, 3, 4, 5, 6, 7, 8, 9. So we had 30 people, and then we needed 9. So every third person was actually answering. So what we do is every third person is going to answer our research question. So you see, we go to every third person to make sure that by the time we get to the last person, there is no bias. And the first person is sampled randomly. So you see, every third person is sampled. Are you getting it? So if we have 100, let's say 30 people, and we need 10, then 30 divided by 10, 3. So your sampling interval is going to be every third person. If we have 50 people and we need 10, then it's going to be 50 divided by 10, which is 5. So every fifth person. So the first person is selected at random in the class. Then you move to the next fifth person, the next fifth person, so you get the required sample size you want. Next slide. Okay, stratified random sampling. So sometimes we realize that, let's say, let's take 3 countries in Africa: Ghana, Nigeria, and Egypt. Egypt, I know that their population, they are 80,000. Nigeria is, they are 80 million. Nigeria is 150 million, and Ghana, we are 30 million. If we want to look at COVID-19 vaccine acceptability, and then Nigerians are like 150 million, if we select, let's say, 100 Ghanaians, we are 30 million, and then they selected 100 Ghanaians. Then Nigerians are kind of 5 times more than Ghanaians. So we should rather take 500 Nigerians, and kind of the Egyptians are kind of half of Nigeria. So we should be taking around 75 of Egyptians. So simple random sampling. We want to make sure that according to your population size, you have equal representation. So and last example, like I said, if you come to Africa, Ghana, we are 30 million, Nigeria 150 million, and then Egypt, let's say they are 90 million. Ghana is, if we take 10 people from Ghana, Egypt are like 3 times of Ghana. So 3 times 10 is going to be like, the 3 times 10 is going to be like 30. So 30 people should be taken from Egypt. Nigeria is 5 times of Ghana. So 5 times 30 is going to be, 5 times 10 is going to be 50. So depending on your population, we increase the number of people per proportion of your population. So go back, I think there is one example. Good. In one class, Muslims were 40%, Christians were 30, and traditionalists were 30. We wanted to take 1,000 individuals. So how many Christians? We will take Muslims 400, Christians 300, and then traditionalists 300 to get the 1,000. So that is the strata here. Eben, go back. The strata here are, the first stratum is Muslims, Christians, Nigerians. The other example I give, the first strata was the Ghanaians, second stratum Nigerians, the third stratum is the Egyptians. So go to the next. So you go inside each of the stratum to know that, oh, okay, this is bigger. You see the population size number 1 and 2. The number 1 is a bit bigger. The number 2 is smaller. Number 3 is very big. So more people should be selected from number 3 than the number 1 and 2. And that is what we mean by stratified proportional. According to your population, if you have high population, according to your proportion in the sample, more people are going to be selected. Next slide. Stratified is proportional. In this case, you stratify them, let's say, according to Muslim, Christians, traditionalists, Nigerians, Ghanaians, and the rest. But in this case, you are not going to add any proportion because their population is mostly not known. You don't know their population. So you don't know, like Christians, Muslims, traditionally, you don't know that one is 40%, one is 60%. You don't know all these things. And therefore, you cannot use stratified proportional sampling. You rather use stratified disproportional sampling or disproportional stratified sampling. So you can see we have the strata, but an equal number of people are selected from each stratum. Next slide. There are 3 disadvantages of stratified random sampling. It ensures it ensures that all strata are presented. So the advantage, everybody is presented. It gives a precision of the overall estimates, and is greater than the precision here is greater than the simple random sampling. Because in simple random, you may the first 30 to sample may be Christians, not knowing Muslims are higher in the class, and that is a bias. So here gives a more precise evaluation. Next. Cluster sampling are actually, it's like the proportional sampling, but clusters are actually used mostly in clinical trials. And mostly, let's say one village is given as a cluster, there is an image. So here, clusters here actually mean a natural phenomenon. Like a community, you do not alter them. Like naturally, they were born to live in, let's say, this community. So they are the clusters. And also you put simple random or whatever sampling to pick the individual. It's the same as the systematic random. But the cluster means the cluster makes up of a group of people with natural characteristics, like place of birth or residence. Move on. So single stage cluster, multi-stage cluster, they are used in complex studies. I wouldn't want to bother you much about it. I would send you links to read more. I wouldn't want to bother you much about. So single stage cluster, 2-stage cluster, I wouldn't bother myself. You would not really do this. These are multi-stage clusters. We did one. We wanted to look at a study in West Africa. That is the larger cluster. Then the next stage, there is an image to the last stage. Good. So we wanted to look at countries. Then the segment of the countries, we look at the homes, the individuals, and then the sub. So kind of multi-stage clusters, we group people based on the natural phenomenon, like Africans, then Nigerians, those in Edo State. Then we look at those in primary school within Edo State, then we can sample. So those are done with big studies at a national level. Yeah, go to the next. So the same thing, multi-stage cluster, we move down till you get to the individuals of interest. Example is like COVID-19 vaccine acceptability. We can look at Africa, Nigeria, Ibadan, go to the homes and sample people. Yes, so we are moving stage by stage. So this brings us to sampling technique. I'll add sample size calculation and take questions. So you should put in mind that different study designs have different formula for calculating sample size. That is what people don't know. Different study designs have different sample size calculations. So let's go. If it is a cross-sectional study, so there is a paper which you can screenshot and go and read. Let me give seconds. So try screenshot and go and read this paper. It gives you sample size calculation in epidemiological studies, which is case control, cross-sectional, cohort studies as well. So go. Also the clinical trial. So in a cross-sectional study, we can use Eben, go to the previous slide. Yeah, I want you to get the title. I mean, the title and the author is the most important point. Sample size calculation in epidemiological studies by Vane. The name is very complex. Vihos University.
What I meant was that aside from the summary, to the right, there are some things we don't see, like negative dash. There's something there before the next line.
Which one?
He wants you to download.
It seems the stuff is not complete.
No, what
like
you have to do is to download the paper. Just take the name, the title, which is
just take the title and go and search it online. You get the paper
online and download.
All right.
Yes. All right. So sample size calculation. Go to the next. So you download this paper and read. The content of this paper includes, if we have a cross-sectional study, we may want to use a formula called the Cochrane's formula, you can see here, which is n is equal to z squared pq, or p multiplied by 1 minus p, all over the margin of error. Z is the z value at 95% confidence level, which is 1.96. P is the proportion of those who have the disease or who have the condition of interest, 1 minus p, and then E is the margin of error. These ones are terms in statistics. I wouldn't want to go in details. I teach statistics very well, so I know how complex it is as beginners. But for the Cochrane's formula, when you download the paper, it gives you detailed explanation. It's a very short paper, but it gives you detailed explanation. So let's say if I'm looking at the prevalence of diabetes in Nigeria or Edo State in Nigeria, now, how many people am I supposed to take? You therefore have to read and look at a previous paper that actually evaluated the prevalence of diabetes in Nigeria. If you find someone even within the Edo State, that's fine. If you don't find, go to other states. If you don't find some within Nigeria, go to neighboring countries like Ghana or Togo. If you don't get within Africa, go to Europe. But appropriately start within where you are and then expand upwards. So the sample size, somebody will just write a research, prevalence of diabetes in Edo State in Nigeria, and then just said, I picked 200 people and then I interviewed them. No, that is very wrong. Why not 250? Why not 100? So if it is a cross-sectional study, and then you don't know the population size, you don't know the number of people who have diabetes, you are now going to do it. So we use the Cochrane's formula, which is z squared, the z is 1.96, multiplied by p. The p is the proportion of what you are doing. You are doing prevalence of diabetes. So already, what is the prevalence of diabetes according to previous studies? So here you put here, if it is 13%, that would be 0.13, multiplied by 1 minus p, which is 1 minus 0.13, all over margin of error. The margin of error is 0.05 if you are 100% confident. Like I said, these are statistical terms. Read the paper and you'll get a clear understanding of all these things. But I just want to open your eyes to the fact that you would definitely need sample size. Another cross-sectional study, then we have the population size. Example, we want to look at COVID-19 vaccine acceptability among students in University of Port Harcourt in Nigeria. What I'll do is, I already know the population size. So we say here is a finite population. We know the people, the whole total number of students, we know them. So we simply use the Yamani formula when the sample size is known. So the first one, we didn't know the sample size, the population. We want the prevalence of diabetes. We don't know all people who have diabetes. That is what we are going to do. So we use the Cochrane's formula. But now we are using the Yabani formula when we have a known sample size. So here, how many people am I going to sample if I want COVID-19 vaccine acceptability or prevalence of COVID-19 COVID-19 vaccine acceptability among students in Uniports? The n is the capital N over 1 plus NE squared. The small n is what you are looking for. How many people are you going to sample? The capital N is how many students are in Uniports. Then the 1 plus the same capital N again, which is the number of students in Uniport, multiplied by the margin of error squared, which is 0.05. So if you have 1,000 students in If you have 1,000 students in Uniport, it's going to be 1,000 over 1 plus 1,000 multiplied by 0.05 squared. Move to the next.
Oh, okay. It seems our facilitator is off.
Sorry.
For a few seconds. Okay.
Yeah, sorry, I was muted. Sorry.
Okay.
So in a case control study, I have simplified the formula in a study we published recently, and I would share that paper with you. I think that the instructor will share with you along with the video so that you look at how he calculated his sample size in that case control study using the appropriate formula. So what I have realized is, Eben, go back. To Cochrane's formula. People use this formula, whether a case control, a cohort, or whatever, they just use this. It's an incorrect way of actually designing studies, and people do it. And because their supervisors or PIs do not know, they tolerate that. But appropriately, this is the sample size to use for cross-sectional case control. I have papers on cohort. Those I don't like to present lecture notes. Unfortunately, like I said, I do not have access to my PC. When I log into Zoom on my PC, I do not have access and I'm using my phone. I would have shown you all the papers I had wanted to show you to appreciate how they use these formulas and even the study designs to actually compute this. But I'll share with you those papers. If you have questions, I'll share with my email and you can quickly handle them. Yes, next slide. The other part of the lecture is, the questionnaire design. I mean, when you are done with your study design, you know your study population, your target population, you know how you are going to sample them, you know how many people to sample. That is sample size calculation. What questions are you going to ask those people? You design a questionnaire, and note, in designing a questionnaire, we have what we say, there is nothing new under the sun. Search similar studies, read literature, and note the variables that you are going to measure. That is the simplest consideration. In designing your questionnaire, seek statistical consultation. Whatever questions you are going to ask or answer is going to generate it. At the end of the day, is going to serve as your results. And note, statisticians are going to analyze the data if you are not a statistician yourself. So seek statistical consultation throughout your research methods. Next is ethical consideration. The brief history of ethics in medical research originated before the Second World War, when Adolf Hitler in Germany, they were actually using human beings to actually design studies. So previously, when they realized that let's say if they want to see what happens to your brain when you get COVID, they just cut your head into two, open your head and take your brain. And then, okay, when your brain becomes black, then COVID causes black brains. That is how science was before our generation. So people realized that it was unfair to be killing people. Another example was, so in this case, I mean, there were no ethics, no rules governing conducting of research. So if you think Nigerians, when they get COVID, they get erectile dysfunction, you just go and inject them with COVID-19 and see whether they'll get erectile dysfunction. So it was against, people realized, and then they designed what we call the Declaration of Helsinki in Finland. So researchers around the world went to meet in Finland, declared about 11 rules governing the conduction of medical research. And then even with that, people were still violating it. An example is the Tuskegee syphilis study in Alabama in the US. Blacks in the Alabama were given, they wanted to see what happens to them when they get chronic gonorrhea. So they were infected with, when they get chronic syphilis. So they were infected with syphilis. And then they were in the 1942, they were left about 20 to 40 years to see what happens to them. And then from there, substantial laws have been modified to research. And therefore, every institution, if it is a good institution, must have ethical approval board. KNUST, for instance, we have the Medical School Ethical Approval Board. Konfanochi Teaching Hospital, for instance, have ethical approval board. And then they always make sure that your research is conducted with right approval. Next, so after looking at your study design, study sampling techniques, the study population, the sample size, looking at your questionnaire design ethics, you need to measure your dependent and independent variables. I would explain this in a bit. So the independent samples are things that can affect your outcome. They are the factors that can affect your outcome. So example, what are the factors associated with teenage pregnancy? So the outcome here is teenage pregnancy. The factors are school dropouts, peer pressure, streetism, broken homes. So they are the factors. So they are the independent variable, the IV that can affect the outcome, which is the dependent variable. So you need to describe them in your methods. And last part is the statistical analysis. How are you going to analyze? Are you going to look at associations, let's say chi-square or correlation? Are you going to find difference, let's say t-test or ANOVA? Are you going to make predictions like linear or logistic regressions? These are all substantial. So in doing so, research design is critical. It requires expert opinion, especially with dealing with statisticians. So always seek statistical consultants when designing your research. Next one. Thank you very much for joining this evening. It was great talking to you all. I would like to take questions.
Okay, thank you very much, Mr. Stevie, for the wonderful presentation for week 2 of our research training. So we will take a few questions as our time is far less. And as we proceed, please, if you want to ask a question, raise your hand and you'll be called to ask your question. And also, we are being encouraged to drop our feedbacks also on the Telegram page, or any substantial question that you have, you can delve.
Ebenezer,
yes.
Ebenezer, so we said what someone asked, Fortune asked, you know, when we were doing the Cochrane formula, can you go back?
Okay.
Good. So here, when we want to calculate the prevalence of diabetes in, let's say, Edo State in Nigeria, we say the Z is 1.96. P is the prevalence of diabetes obtained from a similar study, whether in Nigeria or elsewhere. 1 minus P and the rest are known. 1 minus the P. So he asks, what if the prevalence is not known? If the prevalence is not known, the population size is not known, nobody has done this study, what you do is you assume that 50%, we call it maximum precision or maximum precision. That is how we call it. So you assume that 50% have the disease, 50% do not have the disease. So in this case, P is going to be 0.5, then 1 minus 0.5, then you go. So let's say it's like, sometimes you can't even find prevalence. Let's say someone was looking at student perception about sexually transmitted disease. I mean, nobody might have assessed student perception. So in this case, you assume maximum precision or maximum variability. So the variability here is the P and then the 1 minus P. You know, if P is 0.5, 1 minus P will also give us 0.5. So if P is 0.6, 1 minus P will give us 0.4. If P is 0.7, 1 minus P will give us 0.3. So if it is not known, you give a maximum variability, which is 0.5 times 0.5. Thank you. I think he understood it. He typed that he's understood. Yeah, so
okay.
Evans,
Okay. Mike here, are you ready to ask a question, or you're okay now? You previously raised your hand.
Okay. Yeah, I'm okay with what he was saying. He actually made the calculation very, very simple. I just wanted to add, if I could, just like you have been doing, get the contact. I wanted to ask if there's a way you could send these kind of research papers, this kind of studies that he shared on the Zoom screen, so that
as we did last week, Mr. Stevie will drop his details also on the chat bottom, and I'm sure he will share the materials also on the Telegram page. So he will put his details in the chat bottom. So if you would like to contact him through his email or details, to be made available, so he will do that. And with the materials too, I'm sure he will share them alongside.
Right. Thank you so much.
Yes.
All right. So thank you for your question. I think for the purpose of today's lecture, I wanted to project those papers so that we practically we could look at how sections of these were written. But I think as part of next week's lecture or next 2 weeks manuscript writing, we will definitely be taking through how sections are written. So don't worry, I will share with you all the papers, and I'll share with you simple and easy papers that were used to calculate sample size. So that this one is even just a formula, but I will show you how they were able to write and obtain the sample size in the different studies. I hope you are okay. So I will share you multiple papers, simple ones, so that you can easily understand.
All right, thank you so much.
You're welcome. Next question, if you have.
Okay, next question in the chat. Sarah, I don't really get. So Sarah is saying that thank you so much, sir. It's so much educative, although I think we can throw more light on the other times of sample derivation and calculation. I don't know if Stevie you get what
basically everything I spoke about is in the paper, but I mean, even if you read the paper, you may have limitations. So I will send you real-time published papers. I mean, papers from our lab that we calculated the sample size. It was it is very easy to understand. Ebenezer, I don't know. Do you have prevalence of HIV paper on the manuscript on your screen? Can you share with us? I would want to use it as an example if you have it.
Let me quickly cross-check.
You should definitely have it, or you can go online and then just search it from research and project that part alone, just the sample size calculation. Yes, as Ebenezer comes, I'm still open to your questions. I'm waiting for, I'm still waiting for, your questions.
So Yes, I think I've gotten one of our papers now.
Okay.
So this one paper was looking at prevalence and risk factors.
Okay.
Yes.
So you can screenshot this. Yeah, I think, okay. Let them see the title.
Yes. Prevalence and risk factors associated with gestational diabetes mellitus among pregnant women. There is a cross-sectional study in Ghana. Cross-sectional study in Ghana.
Okay, go to the sample size calculation section. Good. So you can now see that the sample size calculated was obtained from the formula n is equal to z square p multiplied by over e square, where z is the standard normal variate at confidence interval of 95, which is 1.96. P is the prevalence, which is 10%, and E is the margin of error. So you see, and then you see number 10 in front of the 10. It's a reference to a study which was conducted in a previous or a related study in Ghana here. So when you put them in, you get 1.96 multiplied by the 10%, which is 0.01, and then 1 minus 0.10 all over 0.05 square, which gives us 138. So it's not really a big deal. We will share with you links to all these papers. I'll share with you to calculate a cross-sectional study. To do this, I'll share with you links to calculate all these sample sizes. Eben, make me a co-host. Let me share one paper.
Okay. Okay, so I think you can share now. Mr. Stephen, I don't know if you can hear me. You are co-host now.
Yes, I will share with them now.
Okay. So Khadija is also asking a question. When
I'm coming. Let me finish this.
Okay.
I don't know if they can see.
Not yet.
Can they see this? Can you all see my screen?
Yes.
Good.
Yes.
So this paper was conducted by Charles and Cancer et al. Pi1 plasminogen activator inhibitor 1 in poorly controlled versus well-controlled type 2 diabetes patients. A case control study in a district hospital in Ghana. This was their sample size calculation. This is a simplified version of what I posted earlier. And case list formula giving us n of cases, which is r plus 1 over r multiplied by p minus 1 minus p over all these things are explained here, where r is the ratio of type 2 diabetes to health controls, which is 2:1. So we have what we call matched case control study. Sometimes if you want to make, let's say you want to arrive at, let's say if you get 100 cases, you want 50 controls, that is 2:1. Let's say if you want to arrive at 100, that is 1:1. So you have to predetermine that Z alpha over 2 represent the critical region, which is 0.05. Z beta is the power of the, everything is here, everything. I mean, if you read, I'll share with you this paper so that when you see that when you have a case control study, this is an appropriate way of calculating the sample size. You can see he referenced people, well, also the proportions are those with well-managed and those with poorly managed diabetes. So these are the most important formula. But you realize that people just use the Cochrane's formula when they get 100. They tell us that 100 cases, 100 controls. That is very wrong. Yeah, so thank you. Yeah, let me attend to the last question so that we end the section.
Okay, yes. So Khadija was asking, when carrying a research in the local government or maybe a state, which ethical body are you to seek approval from?
So depending on the nature of the study, there are studies like clinical trial, let's say impact of iron fortification study we did in Ghana here. So long as you are going to give, they are children, and then you are going to give them an intervention, you cannot go with your institutional ethical review board. You have to go to the Food and Drugs Board first. Basically, in Ghana, I know that nationally, the Food and Drugs Board is the standard approval of all clinical trials and others. So you have to take the institutional review board. So if you are conducting it within the states, and it depends on how it's really related. If it can be the whole nation, but if it doesn't require complex intervention, let's say you are looking at COVID vaccine acceptability, which is just questionnaire, your institutional review board is okay. But if you are going to give interventions or the kind of the questions you are going to ask are critical, then it has to be approved by stronger review boards. Especially like Ghana, if it is an interventional study, it must be registered with the Clinical Trials Registry under the Food and Drugs Board first. So we have big, institutional review boards, basically, which is headed by the Food and Drugs Board. Yeah. So if it is big, sometimes you have to go to Food and Drugs Board to seek. But basically, you cannot go without your approval from your main institution. You have to go for your institution as well as the larger one as well. Yeah, thank you.
Okay. Thank you. So someone is also asking about G power. G power basically like statistical power in relation. So he said, in calculating the samples, I didn't see you talk about G power, which could see G power is more related to the statistical power.
So
I don't know whether you throw more about it.
Like when I said, I teach statistics very well. So I have courses I teach in statistics. And if I'm going to expand on these formulas, for the purpose of this class, we are supposed to do, just research designs. So if I was supposed to teach you hypothesis testing, that is when I'll tell you the power, the type 1 error, which is 1 minus alpha, 1 minus beta as the power, and then the beta, which is type 2 error. So, there are graphs and curves that I can use to teach you all these things, but those are purely statistics when you are doing hypothesis testing. So I don't want to go in deep. In fact, you would understand this better when you do statistics. That is why when I was saying, in doing all these things, make sure you go for statistical consultation. I never stop saying that. Yes.
Okay, so I hope this is the last question. We are taking the last question from Uncle Fabi. Uncle Fabi, if you could hear me, you could kindly ask your question. I think you probably be the last person for tonight. Uncle Fabi, if you could hear me, kindly unmute yourself and go ahead and ask your question, or you can probably type your question.
Can you hear me?
Yes.
Okay. I was saying over here in Nigeria, we use the G Power app to calculate sample size. I don't know if it's a pain or I don't know. So I just wanted to know if it's the right.
There are applications online that can be used to calculate sample size. You just enter the particulars. I mean, Chris et al., one of my study, we use online sample size calculators. They are good, but I mean, it is appropriate. We have what we call the stroke checklist. I don't know how well, probably you might be publishing, but some journals like Wiley, for instance, will tell you to submit what we call the Stroop checklist. And it tells you to take whether you calculated and elaborated on how the sample size was arrived. So if you use G-Power, for instance, I mean, you just enter in the details, finish, the answer comes. But the steps, research, we ensure that there is reproducibility. So the stages you went through to arrive at that sample size is always missing. So that is a limitation of those applications, yes. Not
Okay,
G-Power alone. I mean, there are other sample size calculators online. I really use a lot of them, but I don't use them when I'm writing my manuscript because, I mean, there is lack of reproducibility when you use those softwares or apps.
Okay, thank you very much. I hope if Uncle Phoebe, you are okay with the answer.
Yes,
what I have
yes,
to add is that, yes, so most likely that all those apps have been completed with the manual formula that you know. So if you go down into how the apps have been programmed, you get to know that it's the formula that have been used to make the apps. So at this juncture, I would like to say a very thank you to our facilitator for today, Mr. Stephen Opoku. It's a great presentation for today, the second week of the research training. So Mr. Stephen, please, if you put your details in the chat button and also give us your last words so that we could call it a night. Yes.
Okay, I'm actually sending you all my details. My email is osteven275@gmail.com. Then my phone number is, you can reach out to me on WhatsApp or any way you would prefer. All right, so I mean, my last words actually goes in thanks to Torase for this, I mean, interesting opportunity to present. Thank you all viewers, I mean, participants for joining this training. I think it was a great one, and I hope that you apply whatever we've learned here in your manuscript as well as your project or your thesis, dissertations, and whatever, wherever you find yourself. One last thing I would like to say is, research is incomplete without statistics. Put it in your mind. So you realize that when you are doing sample size calculation, we are doing a lot of things. You definitely get lost because of probably maybe you may be weak in statistics. So we would be organizing statistics training. I don't know when, as to when. We've already organized one. I have a lot of Nigerian students who joined. They can testify. So I don't know whether we would collaborate with Torase, but as time goes on, we will try and organize statistics training, intensive one, and we hope that we actually elaborate you guys on statistics so that you can become complete researchers. You cannot become a complete researcher without statistics. So thank you all for joining. It was a great time talking to you, and I appreciate it. Thank you very much. Have a nice evening.
Thank you very much, Mr. Stephen. So to all of us, let's remember to put our feedbacks on the Telegram page, and let's encourage our colleagues to, especially we have more than 200 on the Telegram page, but most of us couldn't join, only few were able to join. So we should try and join in person. And so those interested in the stacks and everything, please stay in touch with Mr. Stephen through his number or email. And I'm sure from there, you'll be able to participate when it's time for us to start the statistics class. So once again, thank you all for joining today's class. See you next week.